I was cycled through quite a number of medications, mostly unsuccessfully, and some actually possibly contributed to a deterioration in my mental health. In my case, I was still frightened of having medication, and probably the biggest fear for me was in approach to discussions around me having ECT treatment, which in my case ended up being the most successful treatment and helped me immensely.
Amanda spoke about the need for medication in her management. Normally, when someone is admitted to hospital, there is a process of psychoeducation whereby we explain what the medication is intended for, how it works, how long it will take, and the expected course. But it's often difficult when someone presents in a psychiatric emergency, as many of our mother-baby presentations do. So in that case, we revert to giving the psychoeducation to the important carers in the mother's life, often her partner, but it may be others. And eventually there will be catch-up in providing that psychoeducation to the mother as her mental state improves. Medication can include antidepressants, antipsychotics, sometimes other specialised medications, and sometimes the treatment can include ECT, as Amanda herself experienced, and she experienced in a very positive way. ECT has many negative connotations in the community. We know it does have a role in some of the more severe perinatal presentations to mother-baby units.
I think also a perinatal psychiatrist would have been really valuable in my care. Being in a general unit, being a general inpatient unit, it would have been wonderful to be looked after by a clinician who is a specialist in that field and understands all the particular treatment options and assisting in formulating my care plan with that level of expertise. I think that would have really made a difference to my outcomes in the end.
So I think in any decision about healthcare, it's important to think about the risks and benefits of a treatment, as well as the risks and benefits of not providing a treatment. And often that decision in perinatal psychiatry is a very tricky and anxiety-provoking decision, but we can still use those principles to come to a sensible decision nonetheless.